Good afternoon, everyone, and I thank organizers for giving me this opportunity. I bring warm greetings from my hospital, Mission Gastrocare, and the team of my hospital. I have few disclosures to make. I have no conflict of interest. My presentation is all about provoking some thought process rather than giving some answers or giving the solutions. I feel honestly that I am not big enough to give solutions or answers. Although my presentation is more about data, but some of the analyses are my own views and I may be wrong. So I'm talking about the power of the three components of healthcare management, which is doctor, patient, and hospital. I've striken this perfect because I think it is for an audience to decide. But the title suggests that there is some misunderstanding or there is some conflict between these three factors, and my presentation is all about to bring some understandings and perspectives of each other and provoke thought process and lead the audience to think about it and find out or lead towards the solutions. The purpose of healthcare is basically a social welfare. It is a basic need. It's not a fundamental right, but the constitution gives right to health and it is very important for the state as well. If you look at the three components separately after independence, all three components have moved forward significantly. The hospitals, look at the numbers, size, the capacities, the technology, everything has moved forward. The doctors' numbers have increased, the super specialty and subspecialty came into the vogue. Training centers have increased, the standardization for treatment have come up. Patients also have become educated, they are more informed, they have a lot of platforms to get information. They have various platforms to complain, they have various platforms to write the reviews about the hospital and doctor. So all three components have progressed and grown significantly. Whether it has grown adequately for the need of our country is a different subject, but they have grown. Now, as I say, the health is a social welfare. The goal should be a social welfare. The progress, the growth, the movement of all three components should lead to a common goal. Instead of happening that, they have diverged. Individually, they have grown, but probably they are not meeting at a common point, at a common goal, because of some or other reason. Why I say that we are not meeting at the common point, if you look at the media or the WhatsApp or the YouTube or the review, not a day goes by and you don't hear something like this. Some complaints against the hospital or some claim against the doctor or some judgment against the hospital or doctor. If you ask the doctor, they'll complain that the profession has not remained the same. It is not remained the promising as before. If you ask the hospital management people, they'll say that treating the people or treating the doctor or getting the doctor is difficult. Retaining the doctor is difficult. So all three components are somehow not happy. They are playing their own music, but they are not in a harmony with each other. So the final product is not as melodious as it should be. So through my presentation, I'll just intend to go through the process, how we have come to this point, and I leave it to the audience to find out the problems, find out the points where we have led on the wrong direction. After independence, the health was a subject of state. There was hardly any private involvement in the healthcare system. Government established a lot of health committees. Their job was to analyze the existing health system and suggest the suggestions to improve the health system. Lot of things have done. Despite the efforts, the public sector healthcare system remained deficit. Something has not gone right. If you want to become harsh, you would say that administration has failed. If you want to say little polite, you would say that it's a massive country. As a developing country, probably we do not have enough resources or enough fund to fulfill the all requirement immediate after post independence. Our GDP spending is not also massively great. But despite the limitations, I would say that healthcare has done reasonably well. If you look at the indicators of healthcare, the common indicators which have been used are like 5-year mortality or the maternal mortality or the life expectancy. It has grown significantly high. In 1930, the life expectancy was somewhere around 30-35 years. Today it is around 70 years. So despite the limitations, the healthcare have done reasonably well. Now, post-independence, over a period of next 50 years, the private sector has overgrown the public sector healthcare system because of various reasons. The data says that 70% of Indian population takes treatment from the private hospitals. Recently, probably that percentage has changed a bit because of a lot of schemes in the vogue. Till 2000, the majority of private practice was led by general practitioners, small clinics, nursing homes, smaller scale hospitals. There was a characteristic of this practice, small scale practice. They were more of like a paternalistic. They were like a relational, community based. The doctor was also staying in the same community, same society. They used to discuss a lot of other things other than the treatment. They will ask about the patient's financial situation, they will ask about their business, they'll ask about their daughter's marriage, etc. etc. So everything was discussed and it was a kind of community based practice. It was kind of self regulated. The disadvantage was that it was largely unorganized. They can give a primary and secondary level of care, but they had a limitations for giving a tertiary care system. They had a limitations in technology because it is costly. They cannot afford to buy so much of costly technology, and hospitality was not there. It was only a treatment. There was no hospitality. Something changed in somewhere around 1991. A lot of reforms happened, the economical reforms, etc., etc. The liberalization allowed private players to come into the healthcare system as well as in insurance. If I'm not wrong, 51% FDI was allowed in healthcare system in 1991, and in 2000 it gone up to the 100%. So these all changes led to corporatization of healthcare of an India. These are the data. Year-wise, if you see, massive amount of investment have come into the India, massive amount of the bigger scale hospitals established in India. After liberalization, the investors, the businessmen realized the potential of the healthcare system of India. From 1997 to 2017, massive amount of investment have come into the healthcare system of India that was in the private. Initially, they entered into the metro cities. Later on, Tier 2 and Tier 3 cities are also being penetrated. Cities like Anand and Dahod and Kutch have been penetrated by corporate hospitals. Now, what corporate hospitals bring on table? They bring on table a lot of massive good things. They provide world-class infrastructure, advanced technology. They give employment because it's a compartmentalization. A lot of departments, they provide employment to a lot of Indian people. They brought the professional administrative management. In the past, all administrative was 2 or 3 staffs and doctors. Today, every aspect has a separate department and they are being managed professionally. They have concentrated a lot on hospitality also. In the past, it was more of a treatment. Today, they actually sell the hospitality. But all these things comes at the cost of massive investment. So massive investment been done for an healthcare system which have their own expectations as well. But apart from corporatization bringing so much of positive things, that also led to a lot of other things. The smaller scale hospitals, the nursing homes started wiping out. The doctors have become an employee. Despite being a main pillar of the healthcare system, they have practically become an employee. They have lost their autonomy. Let's be honest, people would say that the corporate hospitals do not interfere in the clinical management, but directly or indirectly, consciously or subconsciously, it affects the decision makings. The stakes and say of the doctor have reduced or gone zero. Lot of insecurity is being developed. The most important thing which corporatization had leaked, not no one has recognized, is that it has reduced the contact time between the doctor and patient. It's 5, 10, or 15 minutes of consultation in OPD. Rest all things are being managed by the management staff, the non-medical people. So that contact time has reduced, which was a very important part to building a trust and doctor-patient relationship. The approach have become a target-based. The business principles are applied. I must say that medical profession is such a profession, it cannot be treated as other business. You cannot apply all business principles to this profession, otherwise this profession will lose its dignity. The goalpost has changed. It has changed from the social welfare to the profit making. Obviously, the people are putting a lot of investment, they would expect the return of investment. The costs have gone up. Even the new trend has started. People are looking at the P&L sheet, they are building a massive valuation and selling it off. I think we need, so corporatization has brought a lot of good things, but we need a brave leaders who would say that the healthcare will definitely make a profit, but let us focus on the values rather than the primary focus as a profit making. What is the story from the doctor's side? The graduation, the post-graduation, the super specialty came in the vogue. If you have to become a super specialist, a neurosurgeon, a GI surgeon, you have to spend 15 to 16 years of your prime time of your life in the training, which is one of the highest training period across the world for any profession. Educations have become costly. Close to 50% of medical seats are paid today. And some of the super specialties, the paid seats cost you in lakhs and crores. Think about it. A person who has paid crores to get that degree, how will he or she behave when he comes into the practice? The patient movements have also changed. In the past, patient used to go to the general practitioners first. General practitioners used to be the first contact point. They'll treat the basic things and divert the patient to different specialty and super specialty according to need. Today, patients are going directly to the super specialist because of the information they have, because of the awareness they have. The patients are also, rather than going to the smaller nursing homes or clinic, going to the bigger hospitals. If you become a super specialist, you need an infrastructure to work, which means that you have to either settle in Tier 1 or Tier 2 city. So Tier 1 and Tier 2 cities, a lot of competitions have been built up. It is very difficult time for newcomers to settle in Tier 1 and Tier 2 city now. If they want to make their own hospital, they'll have to put a massive investment in that. This all led to corrupt practices. So that is a story from doctor's side. Just to put the things on perspectives, what would be the doctor's share out of the patient's bill when patient is getting treated in a bigger hospitals? It's in the range of 10 to 20%. The main pillar of the healthcare system gets 10 to 20% of that bill from the patient. Nobody calculates the liability, the responsibility, and the first answerability doctor takes. We can discuss the intellectual investment versus financial investment. It's a different topic. This is just to give the perspectives. Forget about everything. Why the business principles cannot be applied to this profession? There are three important things of medicine, and probably COVID must have made realize many of us that we all are vulnerable. So when patient comes with a disease and pain and symptoms, they are vulnerable, they are emotionally in a bad shape. The medicine is an incomplete science. There are a lot of uncertainties, a lot of unpredictabilities. How do you deal with vulnerability, uncertainty, and unpredictability? The only thing which can deal with this aspect of medicine is the trust, the connection, the empathy. You can never build the connection between building and doctor. You can only build connection between a doctor and patient. So doctor patient relationship, the trust factor has gone down, which is a major factor. I am not blaming corporates, but if you match the timing of corporatization and the timing of rising in the violence against the doctor, the matching. The corporatization started in next 5 years, the violence against doctors started. I would repeat, I would not blame corporatization, I would blame doctors. We as a doctor are responsible. Becoming a part of the commercialization or corporatization, it's not bad thing. I would say earning is not a bad thing, but we would have taken care of this trust factor, the doctor-patient relationship part. If we would have stick to our values and principles, despite being part of the corporatization, probably these situations might not have come. What do patients think today? They have a poor trust on the healthcare system. They always see everything by the prism of doubt. They feel that we are looting the people. They think that patients are being kept unnecessarily in ICU, unnecessary reports being done, unnecessary treatment is being done, and it is too costly. Now, rather than blaming each other, let's think a little further. How are we as a people? I have heard somewhere that your presentation is good if you touch the 50% of the audience and if you offend the 50% of the audience. So we as a people, we as a society, we do not have a critical thinking. I'll tell you, I have a lot of real life examples to give. I'll tell you one or two examples. A patient, 34, 40 years, female patient, had a cesarean section 4 months ago. She developed cancer of the rectum. The patient's husband and the lawyer comes to my OPD and says that the doctor which did a cesarean section did something wrong, because of that my patient developed a rectum. I mean, where is the critical thinking? Patient and patient's relatives may say that, but how can a lawyer comes to me and say that, write down something like this, we want to sue the doctor. So we as an Indian, we don't think deep, we don't dig deep, we don't have a critical thinking. We have a very corrupt mindset. Recently I was gossiping with someone and somebody said that a person from the very rich family driving the BMW comes up with a PMJY card. His orthopedic friend being told that, do the knee replacement of my mother on this card. I'll pay for extra for the advance implant, but rest of the money you will get from the card. A guy who is driving the BMW and Audi comes up with this idea. So there are lots of examples. I'll put some data. You know what truckers pay on an average 222 crore bribe annually to drive their truck on the roads. It is underestimated, but 62% of Indians have paid bribe at some point of time. In a corruption index, out of 180 countries, India ranks 98th. So I would say that a problem in our country is probably not a profession specific. It is our society which we need to rethink critically. We need to become less selfish and think little for a greater good rather than blaming each other. I was just going through yesterday night the PMJY and Ayushman card system. I looked at the indication, the eligibility criteria for this card. They are fantastically devised. Somebody has really put in the work for doing that. And I was really feeling good that whatever tax we are paying is going for the good. But when I look at the people, those who are untitled to this scheme, I feel that most of the people coming with, I would not say most of the, but many of or majority of people coming with this card probably are not eligible. So I made some calls to friends. I just wanted to know what is the ground situations. And they said that if you want to have a card for any of your family member, it is possible. The point I want to make is that as a society, we are probably going in a wrong direction. We are too much on the Excel sheet and P&L sheets rather than doing something greater good. Despite having such a fantastic scheme, I'm pretty sure after some time the sustainability will become an issue. So I'll just say that the way forward probably would be that doctors should focus back on the doctor-patient relationship. It is the responsibility or onus is on us to bring back the trust. We should avoid corrupt practices. I know it is difficult in today's era, but I think you can survive even without doing a corrupt practices. The people of the society need to realize that medicine is not a maths and doctors are not God. We do not carry a magic wand. The medicine is an incomplete science, lot of unpredictability. Society also need to rethink about their own perspectives and thought process. Corporatization is good, but you need to, the management people need to think that you cannot apply all business principles to this business or to this profession. I would not say even this as a business. A management guy need to have a guts to say the investor that we will make the profit, but let's focus on the values. The earning this profession should be a byproduct rather than a primary point. I'll tell you, even if you consider it as a byproduct, this profession has a lot of potential and you make enough money, more than enough money to survive. Sustainability of this scheme needs to be evaluated because as a country, our mindset is corrupt. We need to strengthen the public sector hospital. That is probably where we are lacking because even today we are doing a partnership between the public sector and private sector. So ultimately, private sector will have a dominancy or the predominant hand there. If the public sector healthcare is superb, probably the public's anger would go down. Let's embrace the concept of collective altruism, right? We need to have a coordinated efforts. We need to think about collective benefits of all. We need to target the greater good and long-term prosperity rather than the short-term goals. We need to understand each other's perspectives. Rotten eggs are everywhere. Rather than judging all of them with a one mindset, let's understand each other's perspectives and focus on the healthy society. We need to think. As I said, my idea of this presentation is just to provoke thought process rather than giving any solutions because I'm too small to give solutions. With that, I'll end my talk. Thank you very much. Very good.